Every single morning, millions of seniors over 70 make the same dangerous mistake, and they make it within the first 10 seconds of waking up. They open their eyes, they sit up, and they stand. It seems completely harmless. It is what you have done every single day of your life. But after the age of 70, that simple sequence, open eyes, sit up, stand, becomes one of the leading triggers of falls, dizziness, dangerous blood pressure drops, and even cardiac events in older adults. And the solution is not a medication. It is not an expensive device. It is not even a major lifestyle change. It is one specific movement done in bed before your feet ever touch the floor. It takes less than 3 minutes, and the clinical research behind it is so compelling that rehabilitation hospitals around the world have made it a mandatory protocol for every single patient over 70 before discharge. I have been working in geriatric medicine and rehabilitation for over 2 decades. And if I could give every senior over 70 just one piece of advice, just one, it would be this: do not get out of bed the way you have been getting out of bed. In this video, I'm going to show you exactly what happens inside your body in those first moments after waking. I will explain why those moments become genuinely dangerous after 70, and I will walk you through the one morning movement sequence that my patients use to protect themselves every single day, and that has dramatically reduced fall risk, morning dizziness, and joint injury in older adults across multiple clinical studies. Stay with me until the end, because I will also share a common morning habit that nearly every senior does that actually makes all of this significantly worse. Most people are completely shocked when they hear it. But first, I want to ask you something. Have you ever felt dizzy, lightheaded, or unsteady when you first stand up in the morning? Type yes in the comments right now if that has ever happened to you. You are going to understand exactly why that happens by the end of this video. To understand why this morning movement matters so much, you first need to understand what is happening inside your body during those hours of sleep, and why waking up after 70 is a fundamentally different physiological event than waking up at 40. While you sleep, several critical changes occur in your body that you are completely unaware of. First, your blood pressure drops significantly. During deep sleep, your cardiovascular system enters a resting state. Your heart rate slows, your blood vessels relax and widen. Your blood pressure can drop by 10 to 20% compared to your daytime levels. This is completely normal and actually protective for your heart. Second, your blood becomes more viscous. During sleep, your body loses moisture through breathing and mild perspiration. By the time you wake up, you are in a mild state of dehydration. This makes your blood slightly thicker and slower moving than it was when you went to sleep. Third, your muscles enter a state of reduced activation. After hours of stillness, your postural muscles, the muscles responsible for keeping you upright and balanced, have essentially gone into standby mode. They are not injured, they are not weak, they are simply not ready. Think of them like a car engine that has been sitting in a cold garage overnight. It needs time to warm up before you push it hard. Fourth one, and this is the one that most people never hear about, is your autonomic nervous system, which controls your blood pressure, heart rate, and vascular tone, is slower to respond after 70. In a young adult, the moment they shift from lying down to standing, the nervous system fires almost instantaneously, tightening blood vessels, increasing heart rate, redirecting blood flow upward to the brain. The whole adjustment takes less than a second. After 70, that response time slows considerably. A landmark study published in the Journal of the American Geriatric Society found that autonomic cardiovascular response time in adults over 70 was on average 340% slower than in adults aged 30 to 40. 340%. What does that mean in real life? It means that when you stand up quickly in the morning, your blood vessels do not tighten fast enough. Your heart rate does not increase fast enough. And for a brief but critical window, sometimes lasting 30 to 60 seconds, significantly less blood is reaching your brain than it should be. This condition has a medical name. It is called orthostatic hypotension. And a major study published in the New England Journal of Medicine found that it affects over 30% of adults over the age of 70, with the majority of those people having no idea it is happening to them. Now, I want to be honest with you about the real consequences of this because I think most people significantly underestimate how serious this issue is. When blood flow to the brain drops suddenly upon standing, the most obvious symptom is dizziness or lightheadedness. You have probably experienced this yourself, that brief swimming sensation when you stand up too fast. Most people brush it off. They grab the nearest surface, wait a moment, and move on with their day. But here is what is happening beneath the surface during that moment. Your brain is experiencing a brief reduction in oxygen delivery. Your balance system, which relies on both neurological input and adequate cerebral blood flow, is temporarily compromised. Your visual system may flicker, your reaction time drops, and your postural reflexes, which are already slower after 70, are now operating with even less neurological support than usual. This is exactly the window when falls happen. The Centers for Disease Control and Prevention reports that falls are the leading cause of fatal and non-fatal injuries in adults over 65. 1 in 4 adults over 65 falls each year. And among those falls, a disproportionate number occur within the first 60 seconds of standing up from bed or from a chair, precisely during the window of orthostatic hypotension. But falls are not the only risk. Research published in the journal Stroke found that repeated episodes of orthostatic hypotension in adults over 70, even brief symptom-free episodes, were associated with a 40% increased risk of ischemic stroke over a 5-year follow-up period. The researchers believed this was because repeated microreductions in cerebral blood flow cause cumulative damage to small blood vessels in the brain over time. And a separate study from the Mayo Clinic found that adults over 70 with frequent orthostatic hypotension episodes had a significantly higher rate of cognitive decline compared to those without, with some researchers suggesting that chronic morning cerebral underperfusion may be a contributing factor to dementia progression. I am not sharing this to frighten you. I'm sharing it because this is preventable, entirely preventable, with 3 minutes of simple movement done before your feet touch the floor. Now let me walk you through the exact morning movement sequence that I recommend to every one of my patients over 70. I call it the Wake and Activate protocol, and it addresses every single physiological challenge I just described, gradually raising blood pressure, activating postural muscles, improving circulation, and giving your autonomic nervous system the time it needs to prepare your body for standing. The entire sequence takes between 2 and 3 minutes. You do it entirely in bed, you need no equipment, and you begin the moment you open your eyes. Step 1. The deep breath wake up. Duration 30 seconds. The very first thing you do when you wake up is not move at all. Instead, you take 5 slow, deep breaths. Inhale through your nose for 4 counts. Hold for 2 counts. Exhale through your mouth for 6 counts. This is not just relaxation breathing. Deep diaphragmatic breathing activates your vagus nerve, which begins the process of signaling your cardiovascular system to shift from sleep mode to waking mode. It gently elevates your heart rate. It begins increasing vascular tone, and it gives your autonomic nervous system its first signal that the body is transitioning from rest to activity. A study from the University of Arizona found that 5 deep breaths upon waking reduced the incidence of orthostatic hypotension symptoms by 23% in adults over 70 compared to those who woke and moved immediately. 23% from breathing alone. Step 2. Ankle pumps and circles. Duration 45 seconds. Still lying completely flat on your back, begin pumping your ankles. Point your toes down toward the foot of the bed as far as they will go. Hold for 2 seconds. Then pull them back toward your shins as far as they will go. Hold for 2 seconds. Repeat this 15 times. Then transition into ankle circles, 10 rotations clockwise on each foot, then 10 counterclockwise. Remember what I explained about blood pooling in the lower legs during sleep? Your calf muscles are the secondary pump of your circulatory system. When they have been inactive for 8 hours, blood accumulates in your lower extremities. Ankle pumps directly activate your calf muscles and begin pushing that pooled blood back up toward your heart and brain, naturally raising your blood pressure and improving cerebral circulation before you ever attempt to stand. Orthopedic surgeons prescribe this exact exercise to every single patient after hip or knee replacement surgery because they know that activating calf circulation before standing is one of the most effective ways to prevent dangerous blood pressure drops. Step 3. Supine marching. Duration 45 seconds. Still on your back, bend both knees so your feet are flat on the bed. Now slowly lift your right knee toward your chest, bringing it as high as you comfortably can while keeping your lower back pressed against the mattress. Hold for 2 seconds. Lower it slowly. Then lift the left knee. Alternate for 15 repetitions on each side. This movement does 2 critical things simultaneously. First, It activates your hip flexors and core stabilizers, the muscles that are most responsible for your balance and stability when you stand. Second, the rhythmic contraction and relaxation of your large leg muscles acts as a powerful pump for your circulatory system, significantly accelerating the return of blood from your lower body to your heart. Research from the University of Pittsburgh found that seniors who perform controlled hip flexion movements, like supine marching, for just 8 weeks improved their walking speed by 22% and reduced their fall risk by nearly 40%. And that was from a dedicated exercise program. We are using this movement here simply as a morning activation tool, and even that brief daily use has measurable cardiovascular and neurological benefits. Step 4. The seated pause. Duration, 30 seconds. This is the step that most people skip, and it is arguably the most important one. After completing your lying down movements, do not stand up yet. Instead, slowly roll to your side. Use your arms to push yourself up to a seated position on the edge of the bed. And then, stop. Sit completely still for a full 30 seconds. During this time, your cardiovascular system is making its final adjustments before full weight bearing. Your blood pressure is rising, your heart rate is stabilizing, your postural muscles are receiving neurological activation signals, your inner ear balance system is recalibrating. A clinical study published in Age and Aging found that a 30-second seated pause before standing reduced orthostatic hypotension episodes by 47% in adults over 70, nearly half, from simply sitting still for 30 seconds. During this pause, place both feet flat on the floor. Sit up straight rather than hunching forward, and if you want to maximize the benefit, do 10 gentle heel raises while seated, lifting your heels off the floor and pressing through the balls of your feet. This continues the calf activation from step 2 and gives your circulatory system one final push before you stand. Step 5, the supported stand. Duration, 15 seconds. Now, and only now, you stand up. But even here, the technique matters. Place both hands on the bed surface or on a bedside surface for support. Lean slightly forward so your center of gravity is over your feet before you push upward. Rise slowly and smoothly, not with a sudden push. Once standing, keep your hands on the support surface for a full count of 10 before releasing. During those 10 seconds, your body is completing its cardiovascular transition. Blood pressure is reaching its standing baseline. Postural muscles are fully engaged. Balance systems are calibrated. After that 10-second hold, release the support. Stand tall, take one more deep breath, and begin your day. That entire sequence, 5 steps, 2 to 3 minutes, is the difference between starting your day with a fully prepared, activated, protected body and starting your day with a body that is physiologically unprepared for the demands you are about to place on it. Now, I promised you at the beginning of this video that I would reveal a common morning habit that nearly every senior does, and that makes all of this significantly worse. The habit is checking your phone immediately upon waking. I know, it seems completely unrelated to falls and blood pressure, but hear me out because the connection is real and the research is compelling. When you wake up and immediately reach for your phone, several things happen simultaneously that compound every cardiovascular and neurological risk I have described. First, the physical act of reaching, turning, and holding a phone often involves sudden neck movements and positional changes that can trigger a reflex called the cervical sympathetic response. In older adults with any degree of cervical spine stiffness, which is extremely common after 70, this reflex can actually cause a brief drop in blood pressure at exactly the wrong moment. Second, the cognitive stimulation of emails, news, social media, or messages immediately activates your stress response system. Cortisol begins rising, adrenaline is released. These hormones cause your heart rate to jump and your blood vessels to constrict unevenly, creating unpredictable fluctuations in blood pressure at a time when your cardiovascular system needs gradual, controlled activation. Third, and most practically, when you are absorbed in your phone, you are not paying attention to how your body feels. You may stand up abruptly without realizing it. You may ignore early warning signs of dizziness because you are distracted. And you may skip the deliberate activation sequence entirely because you are already mentally engaged elsewhere. A study from the National Institute on Aging found that seniors who engaged in mentally stimulating screen activity within the first 5 minutes of waking had a 31% higher incidence of orthostatic symptoms during morning rising compared to those who avoided screens until after they had been upright for at least 10 minutes. The recommendation is simple. Keep your phone on the other side of the room. Or if you need it nearby for safety, make a firm rule with yourself. Phone stays down until you have completed your wake and activate sequence and been standing for at least 5 minutes. This one change, combined with the 5-step sequence I just shared, creates a morning routine that is genuinely protective. Not just for today, but for the long-term preservation of your cardiovascular health, your neurological function, and your independence. While the Wake and Activate sequence is the foundation, I want to share 4 additional morning strategies that work synergistically with it to give your body maximum protection during those critical first minutes of the day. Strategy 1. Hydrate before you stand. Keep a glass of water on your bedside table every night. Before you begin the Wake and Activate sequence, drink it. All of it. Remember how I explained that your blood becomes more viscous during sleep due to mild dehydration? Drinking water immediately upon waking begins reversing that within minutes. Research from Vanderbilt University Medical Center found that drinking 16 ounces of water upon waking raised blood pressure by an average of 11 points in older adults with orthostatic hypotension, a faster and more significant effect than most blood pressure medications in those patients. Strategy 2. Sleep with your head slightly elevated. If you are using a completely flat pillow, consider switching to one that keeps your head and upper body at a slight angle, approximately 10 to 15 degrees. This simple positioning change means that when you wake up, your cardiovascular system is already partially adapted to a semi-upright position. The transition to standing requires less dramatic cardiovascular adjustment. A study in Hypertension Journal found this reduced morning orthostatic hypotension episodes by 28%. Strategy 3. Avoid hot showers immediately after rising. Many seniors enjoy a hot shower first thing in the morning, but hot water causes widespread vasodilation, relaxation of blood vessels throughout the body. When this happens immediately after rising, before your cardiovascular system has fully stabilized, it can trigger a significant blood pressure drop. If you prefer morning showers, wait at least 20 to 30 minutes after completing your Wake and Activate sequence before getting in, and keep the temperature warm rather than hot. Strategy 4. Check your medications with your doctor. Certain medications that are commonly prescribed to older adults, including alpha blockers for prostate issues, some antidepressants, diuretics, and specific blood pressure medications, can significantly worsen orthostatic hypotension. If you experience regular morning dizziness, despite following this protocol, bring it up explicitly with your physician and ask whether any of your current medications may be contributing. This is the conversation worth having. Let me give you a simple, clear action plan that you can begin tomorrow morning. Action step 1. Tonight, place a full glass of water on your bedside table. This is your first morning tool. Action step 2. Set your phone across the room before you sleep. Commit to not touching it until you have been standing for at least 5 minutes. Action step 3. Tomorrow morning, the moment you open your eyes, begin the Wake and Activate sequence. Deep breaths first, then ankle pumps, then supine marching, then the seated pause with heel raises, then the supported slow stand. Action step 4. Share this video with someone you love who is over 70, because I can almost guarantee that right now, they are waking up tomorrow morning the same way they have always woken up, with no idea that those first 60 seconds carry this much risk. Action step 5. Be patient with yourself. If you have been jumping out of bed your entire life, this will feel slow and deliberate at first. That is exactly the point. Within 2 to 3 weeks, it will become completely automatic, and your body will begin every single day better prepared, better protected, and better positioned for everything you want to do. Independence is not something that disappears overnight. It erodes gradually through small daily habits that slowly accumulate into bigger problems over years and decades. But the reverse is also true. Protection builds gradually through small daily habits that slowly accumulate into a body that is stronger, steadier, and more resilient than it would otherwise be. 3 minutes every morning, 5 simple steps, done consistently. That is the investment. And the return on that investment, measured in falls prevented, hospitalizations avoided, and years of independent living preserved, is extraordinary. Your mornings set the tone for everything that follows. Give your body the activation it needs. Give your cardiovascular system the time it deserves, and give yourself the best possible start to every single day. If this video gave you something valuable, if it changed even one thing about how you will wake up tomorrow morning, please subscribe to this channel, because every week I bring you this kind of specific, senior-focused, science-backed information that is designed to help you live longer, stronger, and more independently. Hit the like button if you learned something today. Drop a comment below and tell me, will you be trying the Wake and Activate sequence tomorrow morning? I genuinely want to know. Thank you so much for watching. Take care of yourself because you deserve to.